Thank you very much, Professor Kenneth, and thank you for a very wonderful talk earlier. I really enjoyed it, and I'm here to present my paper, a study that we did regarding the academic experiences, physical and mental health impact of COVID-19 on students and lecturers in healthcare education. Okay, so we know that we had to change to a massive technological transformation during the COVID-19 pandemic, where everything had to be online, education had to be online, students and lecturers had to convert everything online. And we wanted to investigate the evidence for online education. Is it an effective and an efficient learning environment? That's what we did in our study. So I'll mention the authors later, all the co-researchers at the end of my talk. But first of all, I'll go through the objectives of our study, which were to investigate students' learning experiences, as well as lecturers' experiences in teaching and assessments. And in our study, we also described the impact of online education on students and lecturers' physical and mental health. So our study was a cross-sectional questionnaire-based study where we recruited a total of 279 undergraduate students and 56 lecturers from Institute of Health Sciences, comprising of the following programs, which are in medicine, dentistry, pharmacy, biomedical sciences, nursing, and midwifery. Our instrument was validated and was designed through discussions generated from participants and the research team to ensure the content validity. And the items which were put in the instrument were related to teaching and learning experiences, perceived physical and mental health during the pandemic. It was pre-tested with a group of lecturers and students to ensure its comprehensibility before it was finalized, and it was later validated for the use of the study. So I'd like to now move on to the results. So to answer the objective of the learning experiences of students, we found a few positive learning experiences identified by students. And the most majority identified as being independent, as a positive learning experience, followed by that the students were able to adapt to online learning as well as adapt to the sudden changes. There were other positive learning experiences identified as seen in the results table here. And that included keeping a schedule, being self-motivated, being attentive, as well as being environmentally friendly. There were a couple of negative experiences. The two highest negative experiences identified by students was that they felt distracted when learning or working from home, and they were less certain about assessment and exams. And this was also followed by, that they felt distracted with a noisy background, and there wasn't much of a spontaneous interaction. And that group work was also quite challenging when it came to online learning. When it comes to the experiences of lecturers, the positive ones identified in our study was that the lecturers learned new teaching techniques, as well as becoming creative and innovative, and that they were able to learn new and good tools. However, the lecturers did identify that the laboratory skills of students were felt to be compromised, and that was something that you can't avoid during online education, that laboratory skills had to be compromised, and that sometimes it wasn't easy to control the students' attendances when it comes to online teaching and all the online platforms. Not all the students had 100% attendance, probably because of lack of internet connectivity and things like that. Other things included some uncertainty of students' learning achievement. The positive experiences reported by lecturers in assessment was that they were able to explore all options while becoming creative and innovative while designing the assessments and also delivering it online. However, it did state that it was a little bit difficult to maintain appropriate questions with the level when it comes to designing and providing online assessments. And also, they were unable to ensure a fair assessment, and that the assessments, sometimes you have to make sure the questions were appropriate, and that you couldn't actually you didn't want to show all the questions online just in case of security reasons, and that there was limited questions to use for the future. Our study also described the physical and mental health aspects of students and lecturers. What was interesting in our study was that the students, when it came to online education, they did miss eating outside, and unfortunately they could not perform any extracurricular activities due to the COVID pandemic restrictions. And they did enjoy home-cooked meals as part of the reported physical health experience. When it came to the mental health experience, they did identify feeling more stressed. Fortunately, they felt they had more self-reflection, and 49.5% identified some anxiety when it came to online education. The lecturers, it was interesting that they reported more time for exercise, although they also had more screen time. And with more screen time, obviously, there would be more physical stress due to the computer use as a result of the more screen time. And there was some who reported had carpal tunnel syndrome as well. Fortunately, the lecturers' mental health was identified positively in the sense that they felt closer with the family, although the same percentage also identified more stress with the deadlines, as well as unexpected and disruption in their workload, as well as more workload. But to offset that, they felt closer with the family and being able to spend more time at home. So to sum up the positive and negative experiences as identified in our study, students felt more independent and they did adapt well to online learning as well as the sudden changes. Lecturers did learn new teaching techniques, they became more creative and innovative, and they also learned new tools and applications. Students were happy, they had more home-cooked meals, and that lecturers reported more time for exercise as well as being closer to family. However, the negative experiences identified in our study was that students felt more distracted and also had a lack of spontaneous interaction with the lecturers. Practical and lab skills were obviously compromised, and the lecturers felt that they could really control the students' attendances when it came to the online application platforms when they delivered their teaching. Lecturers also identified some uncertainty about students' learning achievements and some challenges in assessments. When it came to physical health, students identified a lack of extracurricular activities, and both lecturers and students identified the increased screen time led to more computer-related physical stress, such as back problems, dry eyes, and strains, and some lecturers felt they had more carpal tunnel syndrome. So to conclude, COVID-19 pandemic has certainly brought many changes to academia, where we have to convert everything online. There were some assessment challenges. However, we counteracted this by converting examinations into coursework so that they were more appropriate and fair to assess. Our university also cultivated and encouraged a digital learning culture among the community, and that doesn't just include the lecturers and students, but also the administration and support staff, because as our identified by our keynote speaker earlier, it is important to make sure that it is multi-sectoral, where everybody is involved, all the university staff, not just IT people, but also our staff and admin are also involved in cultivating this digital learning culture. Thus, it is important to ensure faculty development to improve the university community's readiness and confidence to utilize digital technology. I know we had to suddenly convert everything to online learning, and for some it was a huge learning curve, where previously when we were so comfortable to deliver things physically, now we have to convert everything online. And we did learn quite a lot from that pandemic, where we actually cultivated our digital learning and our digital transformation improved, where we became more confident and familiar with the use of IT in education. But in order to achieve this, we have to ensure everybody has good equal access to the resources needed, and that also includes good internet connectivity. However, now that the pandemic is over, now that we're in the endemic phase, it is important to ensure sustainability and continued familiarity of online tools. Now, to ensure that we go forward to achieve effective digital transformation, and as our keynote speaker earlier identified it as a game changer, we need to ensure improved quality of innovative teaching methods, as well as upgrading of our tech infrastructure, ensuring there's always provision of various technological resources which fits to our needs as well as the students. Using user-friendly applications and platforms and tools can also ensure online student lecturer interaction, because this was identified to be a bit of a limitation when it comes to online. You're limited to having interaction with your students, but we have user-friendly apps that can allow us to have this online interaction, and these workshops have been delivered throughout the past 2 years to ensure that the university community is familiar with the use of these applications. So we think that digital online education has certainly many advantages. It allows for accessibility, and it can definitely promote lifelong learning, where you don't have to be physically present, where those who are actually working or professionals can actually do lifelong learning courses, at their own time and their own expense. We certainly found that this helped to upgrade our skills and expand our capacity in towards digital transformation. And we feel that using these certain applications can enhance student-centeredness as well and provide flexibility in teaching. So based on our study, we also found that there was a healthy balance between work and family, in that sense that lecturers felt closer to their family. So we feel that it's important to ensure sustainable approach towards a blended physical and online classroom. So it's not just about physical teaching, but we should always try and strive to ensure that we promote and we sustain digital online education, and even though we're in the endemic phase. So hence, we need policies that can guide the use of online or blended technological approaches to deliver teaching and assessments. And when it comes to physical and mental health, it's important to promote the well-being of the university community through health promotion interventions that emphasize on healthy working, learning, and living environments. That concludes the end of my study findings. And our study has been published in BMC Medical Education, and I'd like to thank all the researchers involved in this research, Dr. Ehsan, Dr. Khatiza, Dr. Rahaiza, Dr. Shahid, Dr. Hanif, Dr. Rajan, Prof. Ayu, our keynote speaker, and most importantly, Dr. Shiba, who was the principal investigator of the online education research that was started 2 years ago. Thank you very much.